is for education and entertainment purposes only. Please consult with your healthcare provider before making any changes to your health plan.
Hey beautiful soul, it's Jacqueline here from the Lost Labia Chronicles in partnership with Lichen Sclerosus Support Network. If you have lichen sclerosus and are looking to empower yourself with information, find acceptance, and reclaim your life, then please subscribe to this channel and keep on watching. And if you have a friend or family member with lichen sclerosus and you want to learn more about the physical and mental health aspects of living with LS so that you can better support them in their journey, then please subscribe to this channel as well and please share it with them. All right, so it is a new year, it is 2023, and what a perfect time for us to chat about vulva checks. Yes, this video is going to be all about vulva checks, lichen sclerosus edition. So I'm going to go through what a vulva check is, how often you should be doing one, how to do one, what you should be looking out for specifically in the context of lichen sclerosus, what to do if you notice any changes, and kind of how to document those. So this is a super important video. Absolutely everybody should be doing a vulva check, but especially so if you have lichen sclerosus. So be sure to stick around and watch this until the end. As always, if you find the information in this video helpful, please give this video a thumbs up, a little like, and if you feel so inclined, please share your questions about vulva checks or your experience with vulva checks in the comment section below. If you're watching this video and you're like, what the heck is a vulva check? I've never heard of this. You are not alone. You are in the majority, right? Most people with vulvas don't grow up in an environment where we are encouraged to familiarize ourselves with our genitals. We have next to no knowledge about the proper terms for our anatomy. For many of us, this has just never been brought up. So regardless of your age, if this is new for you, don't worry. I only learned about this after I was diagnosed with lichen sclerosus. Before that, no one had ever mentioned this to me. So don't worry, we've got you covered. That's what this video is all about. So a vulva check is essentially a self-examination of your vulva. Now, for folks that aren't familiar with the terms or for folks that need a refresher, the vulva is the external genitalia. So I'm going to pop an image up here that kind of has, it's a little graphic design of a vulva showing where each kind of part is. So this includes the mons pubis, it includes the clitoral glands and the clitoral hood, it includes the vestibule, the urethral opening, the vaginal opening, the labia minora, the labia majora, the perineum, and the anus. So that's your vulva, and the vagina is what's on the inside. It starts, we have the vaginal opening at the vulva, and then it leads inside to the cervix. So a quick and easy way that I like to remember this is just vulva outside and vagina inside. That's my quick and easy way to kind of remember the two. So when we talk about checking your vulva, we're talking about you checking the external part of your vulva. Okay, so let's talk about why vulva checks are so important and why you should be doing them. Now, of course, there are a number of reasons, but I'm just going to highlight some of the major ones, in my opinion, that express why these are so important for us to do. So the first point and the first reason why doing a vulva check is important is because it helps you know you're normal. It helps you establish and have a good idea of what you look like on a day-to-day basis. And now this is really, really important because we know that all vulvas are different, right? We have different shapes, different colors, different sizes, and none of those are inherently wrong or inherently bad. So if your friend has a mole on their vulva and they've had that since they were a kid, it's been checked out, the doctor said it's benign, there's nothing wrong, that's their normal. But for me, I don't have a mole on my vulva, which means that if I'm doing a vulva check 1 month and I see a mole, that's a new change and something that I need to be aware of because I know that that's not my normal. So that's when it's really, really important. You never want to be comparing yourself to other people's vulvas because that's not your normal, and that might give you kind of false information or confusing information. So, as tempting as it can be to kind of Google image and then compare what you look like to them, I recommend avoiding that if you can and just focus on getting to know you and what you look like. Building on this, Vulva Checks help you establish a baseline. And now a baseline is basically a starting point that you use to track any changes. So you're always comparing against your baseline. Again, you're not comparing against other people, but you're comparing against your baseline. And it can feel really, really empowering to know your body in such an intimate way. The second reason that vulva checks are so important when you have lichen sclerosus is that they can really be an incredible tool to help you track any changes and to track the progress of your lichen sclerosus. So when we talk about tracking changes and changes that are important to lichen sclerosus, it's so important to understand the difference between signs and symptoms. And now I do have a whole in-depth video on the difference between signs and symptoms and why that distinction is so very, very important. And I will leave a card up here that you can go check out. And I will also leave that video link in the description box below for you to check out afterwards. But very briefly, a sign is something that you can visibly see with your eye, whereas a symptom is something that you can feel, right? So I don't see itch on my vulva, but I feel itch on my vulva, and that's why itch is a symptom. So when we're talking about signs of LS, now these of course vary, but some of the more common classic signs of LS are hypopigmentation. So that is essentially a reduction in pigmentation, a loss in pigmentation. So whatever and this is again why it's so important to know your normal, because if your normal is, a deep reddish brown, and then that starts fading in color and starts turning grayish, that might be an indication that there's active LS. So we're always talking about a loss of pigmentation. So that can range anywhere from like gray and ashy to white. It really just depends on the color of your skin. And this is again why it's so important to know your normal and not compare your vulva to images of other vulvas, because it might give you a skewed understanding of what you are supposed to be looking like. Okay, so when we talk about signs that you want to be looking out for, we're definitely talking about that hypopigmentation, that loss of pigmentation. So that's a color change. And then we're also looking for textural changes. So lichen often presents as kind of thickened or rigid, hard skin, right? Sclerotic, sclerosis means hardened and rigid and thick. And that's where we get a lot of issues. So you're also looking for kind of textural changes like that. Another kind of skin/textural change that you can and want to be mindful of is any new fusing or resorption. And if you're unfamiliar with those terms, don't worry, most people are until they get diagnosed with lichen sclerosus. I do have a video explaining those two terms. Again, I will leave a card up here and I will leave that linked in the description box below. And I highly, highly, highly encourage checking that video out. It is also super important that you know what those things are. So these are some of the signs that you're looking for when you are doing your vulva check. Now, one little caveat for this point, when we talk about, a positive thing about doing these checks is being able to track changes and to kind of objectively follow the progress of your condition. This also is important to note that not all changes are bad. So when we talk about tracking changes, sometimes they're good changes, right? Sometimes it's, oh my gosh, my skin, the color is returning, or the fusing doesn't look as bad, or I had this really thick kind of white patch and the thickness is kind of becoming more elastic and more mobile, more like something akin to healthy vulvar tissue. So I just want to note that, tracking changes doesn't always have to be a negative thing. And I think that's really important because LS really affects our mental health, and it can be hard, to think of all these negative things. But sometimes there are positives that we're tracking too, especially when you're on a treatment plan for a longer period of time and you've been doing all of that work, then we're really starting to look at more positive changes to the vulva. So again, super, super important to be doing these checks. Now, of course, there is a final reason why these checks are so important, and that is to catch early signs of vulvar cancer. Now, remember that for folks with lichen sclerosus, we are at an increased risk of developing vulvar cancer. That increased risk is approximately between 2 to 6%, depending on the study. The studies slightly vary in their percentages, but they're all within that range. So slightly higher risk than baseline. That said, it is important to contextualize those statistics so that you better understand your risk. And I do have both a blog post and a YouTube video where I explain these differences. So if you are concerned about this and you want some quick information, then I definitely recommend that you check those links. I will leave them in the description box below. But that said, I wanted to let you know that while this video is like a Vulva Check for LS edition, we are also planning on doing a Vulva Check for vulvar cancer edition. And we're going to dive deep into the vulvar cancer space and tell you all of the things that you need to be looking out for in your vulva checks so that you can catch vulvar cancer early. If it happens, right? Ideally it doesn't, but we want to be proactive. We want to get things caught early. We know that in the majority of cases, catching a condition, a disease, etc. early is so, so, so important to how the rest of your life kind of plays out, right? So the earliest we catch it, the best. So definitely be sure to subscribe to this channel, and this way you will not miss when that video drops. It will go live in 2023, so you'll definitely want to stay tuned for that video. So a common question that folks ask with respect to their vulvar checks is, how often do I have to be doing this? And that's a great question because you want to make sure that you're doing them frequently enough to catch important changes, but not too much that it's now veering into kind of health anxiety and obsessive behaviors territory. And that's where I felt. So we want to avoid that, right? You want to kind of be in the middle so that it's not harming your mental health, but that you are still being proactive and taking care of your body. So most of the, gynecologists and dermatologists that kind of work in that vulvovaginal space, they recommend doing a vulva check once per month. Now, a lot of us in the LS space, we do this on the first of every month. There's no real reason other than the first is just an easy date to remember. But honestly, I always say, find and pick a date that works for you. The first is a good time for me, but if you know that that's when you have a bunch of deadlines or when something's due and you're probably going to forget or skip it, cool, no problem. Find a date during the month, pick that date, set that into your phone. So let's say it's the 15th, like I have reminders, the first of every month, I get a little reminder pop up on my phone, check your vulva, just in case I forget. Same thing if you want to do yours on the 15th. Cool, great, you've picked the 15th, schedule that into your phone so that you get a little reminder, or if you have like a physical calendar and you want to write it out there, cool, write it out there, 15th of every month so that you never forget to do your check. All right, so the following is a really short list of what you need to do your vulva check. So the first thing you're going to want is good lighting. Now this can be from natural light. If you have a nice big bright window at home and you do your vulva checks during the day, that can be a good option. You can also consider getting like a ring light or something like that. What I use is actually, I have this little like headlamp that I got for reading at night. I'm not going to turn it on because it's just going to blind you, but essentially it has light and then it like adjusts, right? So I can kind of like point it to where I want it to be when I'm doing my checks. And I find that it makes me look like a miner, like I'm going to like do some mining work in a cave. I don't know what that entails, but that's what I feel like I'm doing. So this can be a good option. I got this really cheap off of Amazon ages ago, and it's proved to be a very worthwhile investment. So, find what works for you. I know some folks will use like a flashlight and just point that at their vulva, but you want to make sure that you have really good lighting and that you can see. Then, of course, you're going to want a mirror. Now, which mirror you use is honestly up to you. I initially started using like just a compact thing for my makeup. It was like my highlighter and it had a really nice mirror. So I was using that for ages. And then I decided finally, I was like, you know what, I deserve a little upgrade. So I did get this mirror, which is a little bit, not a little bit, it's very dirty, okay? There's another trick, clean your mirror. Don't be like me. Clean your mirror. But suffice it to say, it does have this little stand here so I can kind of adjust to where I want it to be. And I need to charge it, but there is a button here on the bottom that also comes with light. It's not enough light in my opinion. I like a little bit more light, but I still put the light on and then I put my little headlamp on. So I get that. And then you'll also want to get like a bunch of pillows and blankets or a chair or just some kind of support to make you comfortable. You really want to be able to be as comfortable as possible during this and be positioned in such a way where you can fully see your vulva. So some folks like to kind of take their mirror, put it flat on the ground and kind of squat over it. That's not my personal choice, but that is a choice for some people. I personally prefer to do it lying on an incline. So I have one of those GERD pillows, which is like I'll see if I can find an image on Google, but essentially if I can't, it's like an incline pillow. And then I just prop myself up even more. So I'm very upright. And then I just kind of like open my legs, like kind of butterfly style. And then I place my mirror on the angle that I like. I get my little headlamp on and then I am ready to go. Finally, and I'm going to talk about this in a little bit, I do like to have a little pen and a small notebook next to me because I do document my changes there. So again, doesn't have to be anything, fancy. I literally get mine at the dollar store and that's kind of all you need for these checks. Well, no, I lied. Of course, you need yourself. You need to show up. You can have all these materials, but if you don't show up, you're not going to be able to do your vulva check. All right, so you've got your stuff. What do you do now? So you get into that position of choice. Now, I will say that, if it's your first time doing it, you might have to experiment with a few different positions. You might have to play around with your props, with your pillows and bolsters and blankets and such so that you can find what works best for you, right? Because all of us have different bodies, have different physical limitations. So you're really going to need to find what works for you and what works for your body. But once you kind of get that comfortable position, stay there, close your eyes, and I say take 3 nice, big, deep belly breaths to really just start us off and calm down. Then when you feel ready, open your eyes, and then you're going to start doing your vulvar self-examination, otherwise known as your vulva check. And this involves basically checking each individual part of your vulva. So you can do this in any order that you like. For me, for simplicity, I like doing from top to bottom. So here's my little vulva puppet. Now I'm missing the mons pubis up here, but I'll kind of start at the mons pubis. I'll work around this clitoral area. Then I'll do my labia majora. I'll do the inner labia. And this vulva has clearly 2 distinct labia minora and labia majora. Now mine are resorbed, so I can't really move parts, but if your parts still move, be sure to kind of look in the cracks and crevices. Don't be afraid to kind of move things, to try and move the clitoral hood if you can or can't. That's okay, but we just want to kind of know and check. So then I'll work, into the vestibule, the, urethra, the vaginal opening, the perineum, and the anus, which is not on this puppet, but again, I'll flash a picture up here. And you can also just Google an image too if you want, like a diagram, and you can even print that out if you want at first. If you're not super familiar with the parts and you find that might be helpful, you can kind of have that little image next to you while you're doing it. And yeah, so you're just, again, really slowly and methodically feeling around, looking, observing the color and the texture of the skin in all of these different areas. Okay, so while you are individually looking and feeling around those areas of the vulva, what exactly are you looking for? Well, in the context of lichen sclerosus, you are looking for signs of lichen sclerosus. So you are looking to see if there is any new fusing. So is your fusing getting worse? If you have some fusing, is it getting worse? Do you have fusing in a new area? Did you have an area that was fused but is now resorbed? Are you noticing any color changes? Either, like that loss of pigmentation. So again, anywhere from ashy to white, gray, anything in between, but just general loss of pigmentation. Are you noting any fissures or cuts or tears on the vulva? You might also want to be paying attention to texture. Does the texture maybe look like it's improved a little, like it's more elastic and mobile, or does it look thicker in some areas? You're basically looking for those. You're looking for those signs of lichen sclerosus. So those are the main things. Now, of course, there are other things that you want to be mindful of, like hyperpigmentation, which would be, kind of redness, or if your vulva is black or brown, it might start looking more like a purpley bruised color, even almost black. So an increase in pigmentation, that's not necessarily indicative of lichen sclerosus, but definitely something that you still want to be mindful of course. If there are any rashes, signs of irritation, these are important things too that you'll always want to kind of be mindful of. But in the kind of context of lichen sclerosus, we're looking for, are those clinical signs like loss of pigmentation and fusing and scarring and thickening, are those improving? Are they getting worse? Are they in new areas? That's what you're kind of looking for when you're, doing your vulva check. All right, so you've done your vulva check, you've top to bottom or bottom to top or whatever order you prefer, but you've done it. Now let's talk about documenting your vulva check. So I always encourage folks to document how their checks go in some way, shape, or form. So there's two ways that you can do it, and I actually do both each month. So one way to do this is that you can have like a little vulva check journal where you're physically noting down any changes to your vulva. So in my little journal, like I said, I just buy it at the dollar store. I have kind of like a bullet point for each kind of area of the vulva. So I have like a bullet point for the mons pubis, a bullet point for the clitoral area, a bullet point for the labia majora, and so on and so forth. And then under there, I have two other kind of like sub bullet points, and I'll have one for like color, texture, and then other. Other can just be whatever comes up, right? So that can be one way to kind of track your changes, just so that, our memories aren't always perfect. And if you're really busy, you might not always remember how things looked. So to have something to go back to, if you're like, was it there last time? Was I that fused? And then if you look and you're like, oh yeah, I was. Okay. That can be really helpful for those purposes, and also to help you better communicate with your healthcare providers. And then another way to document your vulva checks is to take photos. Now, I am very well aware that this is a sensitive topic and that many folks don't feel comfortable taking images of their taking images of their vulva and keeping that on their phone. And I completely understand. And that is okay if you're not comfortable. I would never pressure anybody into doing anything. I definitely do take pictures because pictures can be a really great tool insofar as they're an objective documentation of what you looked like. And the reason this is so important is because sometimes we kind of get gaslit when we tell our doctors about changes down there. So I've told them like so many times, in the past, this is getting worse, or like my fusing is getting worse. And they say, no, it's not. But I know it is because I've been looking at myself once a month, for months now. And I know that there are changes occurring, but they don't, or they don't remember, because like most doctors don't take photos. My current specialist does take photos, but most, OBGYNs and most dermatologists don't, which means that, they might forget how many vulvas are they looking at in a day, they might not remember. So that can be a nice way to be like, okay, but this was my vulva 3 months ago, and this is my vulva at my latest check. Do you see the fusing that I'm talking about? So that can be a really nice objective way to make your point, and to kind of combat some of that gaslighting that a lot of us do experience. Another reason it can be helpful is that sometimes changes change before we even get into the doctor. So like, have you ever had a rash and you book an appointment with a doctor and they're like, yep, we'll see you next Monday. So you book the call on Monday and they say the following Monday, so 7 days from now. And then on Thursday, the rash resolves. So by the time that you get into the office the next week, that rash that, let's say, was on your arm is completely gone. And now they might say like, well, what did it look like? And most of us would probably be like, I don't know, red, pink, irritated, raised, like that's about it, like in terms of giving, a ton of detail. So for that reason, maybe there was some whiteness, but it resolved, or there was a color change, but you're not sure, but now it's gone. And that might be hard to get your doctor's feedback because they can't physically see it, because when they're looking at your vulva, it's not there. So this way, if you have a photo, you can say, hey, do you see that pigmentation issue there? It's resolved, but is that LS or is that something else? And then they have an objective thing to kind of look at and say, well, it looks like this or that, and then kind of, have a conversation based on what they're seeing. But so I find that those two combined can be really, really great tools. Again, if you're not comfortable with, photographs, you can use a documented kind of like pen and paper journal. That's okay as well. And, just last note for photos, there are a lot of apps they're different for iPhone and Android and stuff like that, but you can kind of check out, there are different apps that will like privately store your photos so that like, if you have kids and they're constantly going through your phone or something, or like friends, they wouldn't find it. I know that there's one that kind of like disguises your private gallery as a calculator, so that if someone takes your phone and they'll see a calculator app. And then if they open the calculator app, nothing will happen. Like it's just a calculator. But if you put in your PIN, then it will take you to your private photo albums where you're storing those images. So that extra kind of level of security makes some people feel a little bit better, but to each their own. I have no issues. I don't even use any of those apps. I just leave it on my phone. Like if somebody comes across it, like, well, sorry, don't go through my phone without asking. I don't know what to tell you. I'm just super open and transparent about my health and my body. So for me, it's just, I don't mind. So I do keep track of my progress on my phone. All right, so you've done your vulva check, you've documented how that went, and you notice some changes. What should you do? So according to the BSSVD, which is the British Society for the Study of Vulvar Disease, if you are currently treating on a maintenance dose, which would mean anywhere from 1 to 3 times a week, depending on your country, if you're on maintenance and you notice new signs of lichen sclerosus, such as hypopigmentation or new fusing, they advise you to go back on your daily treatment. So use your treatment, your steroids every single day for about 2 to 3 weeks. If at the time that you notice these changes, you're already applying your medication daily, they encourage you to call your doctor and get examined as soon as you can. If you're on maintenance and you treat for 2 to 3 weeks and you don't see improvement or things are getting worse, I would definitely give your doctor a call and let them know. Lastly, I personally, and this is just a personal thing, I definitely always like to mention any new changes to my doctors, kind of regardless of where I am on my treatment spectrum, just so that at the very least they have that on my file. So maybe I don't have hypopigmentation, maybe I don't have scarring, but I've noticed that I've torn in a few areas. I would definitely want to let my my doctor know. Again, if nothing else, so that they can get that on my file. And I, will ask them, should I change anything about my treatment? I'm currently treating this way. If so, what is my new protocol going to kind of look at? And then any follow-up questions I have, obviously I will ask those at that juncture. So that's essentially what you would do if you do notice any changes or negative changes or changes that you're not sure if they're good or bad. Definitely, follow those instructions from the British Society for the Study of Vulvar Dermatology, and always advise your doctor of any changes that you see. And if they're positive changes, fantastic. Feel free to also let your doctor know. So again, that they can have this on file, so they have a really clear, history of what's happened to your vulva on their file. And last but certainly not least, one of the most important and often overlooked parts of doing a vulvar check is do some self-care. Vulva checks are so important. They are so important. for your health and for your lichen sclerosus. That said, vulva checks can bring up a lot of emotions to the surface. A lot of people experience a lot of fear and anxiety before looking at themselves. When they do, it can bring up feelings of, and this is just me speaking strictly from personal experience here, but for me, at least initially, it brought up feelings of shame. It brought up feelings of disgust, just plummeted my self-esteem, my body image. There's so much that can kind of come up. And I think that this is something that is not discussed as much, right? A lot of places will tell you kind of why they're important and how to do them, but a lot of them don't talk about the mental health aspect of living with lichen sclerosus and why, this can be so difficult and challenging for us. So definitely prioritize your mental health. Okay, whatever that means. If that means, you give a call, you give your friend a call afterwards to debrief. If that means you watch, one of your favorite movies, if that means you prepare yourself like a comfort meal, whatever it is, whatever food makes you happy. If that means if you have pets, cuddle, give your pets lots of hugs. Whatever it is that makes you feel a little better, do something nice for yourself, because this can be really, really hard. And if you're really struggling, know that there are options for you. You can consider different support groups. There are a ton of free support groups online, different kind of support forums where you can just kind of leave a post and ask people for support or validation or whatever it is that you need in that moment. That's one option for you. You can also join a virtual support group. Kathy and I both co-host the Lichen Sclerosus Support Network's virtual LS meetups. We run those every other Saturday from 2 to 4 p.m. and 7 to 9 p.m. Eastern Time. Those are free to attend, so you can sign up by going to lssupport.net/connect. I will leave that linked in the description box below, of course, if you want to sign up, if you are not already joining us. We would love to have you with us. And then another option, if you're needing that extra support, you can always consider booking a one-on-one lichen sclerosus support call with me. If you're not familiar or you didn't know, I do offer one-on-one individualized calls. I have a free 15-minute consultation to see if we would be a good fit. And then other than that, I have a 30-minute and a 60-minute option, and we can discuss bundles and other things as well if that's of interest. You can also consider reaching out to a therapist or some kind of counselor if you're needing really like extra psychological help with that and you want kind of a trained professional to walk you through. That's another great option. I definitely utilized my sex therapist in the beginning, like a lot. So those are, other support things that you can do. If you're looking for a therapist and not sure where to find one, you can always talk to your primary care physician or your general physician and see if they can kind of help get you started on where to find one. But those can be really helpful to deal with a lot of the things that come up during these checks. And so if you're one of those people that is still struggling to do vulva checks, or you do them, but they still bring up a lot, you're definitely not alone in that. There's a whole community of us out there that have been through that or been through something similar, and we all understand. So just know that, we are metaphorically holding your hand through this. Another exciting thing that I will add to this is that for Lichen Sclerosus, or World Lichen Sclerosus Day, which is January 17th this year, well, every year, but anyways, you know what I'm saying. January 17th is World Lichen Sclerosus Day, and Lichen Sclerosus Support Network has teamed up with Sweet Spot Labs, and we have created a bundle for folks with lichen sclerosus. So this bundle will include products like emollients and body wash that are, good for lichen sclerosus, and it will also include some PDFs, and it will also include a vulvar meditation, so a Vulva Check meditation. So this might also really help with that mental health piece, because here at Lichen Sclerosus Support Network, we are very much aware of and mindful of the mental health piece. with all the information that we disseminate and share with you, we are always thinking about how is somebody's mental health affected and what can we do to also address the mental health piece with everything, with every piece of content that we put out. So with respect to Vulva Checks, you know that if you purchase that bundle, you can get that meditation, which is actually done by one of my pelvic floor physical therapists, Jane, and she is absolutely phenomenal. Her voice is so soothing, so calming, and so having someone, you know, walk you through it in this meditative, calm and soothing voice can sometimes be really helpful to kind of bring down some of those anxieties and stress and fears. So on January 17th, head on over to Sweet Spot Labs. I will leave a link in the description box below for you to check out and get that bundle. It is going to be fantastic. It is filled with so much incredible things to help you on your LS journey. So again, leave that linked in the description box if you want to get that and give it a go. All right, so to wrap things up, Vulva Checks, super duper important for your lichen sclerosus. They help you establish your normal, they help establish your baseline, and they can help you track changes, any important changes to your lichen sclerosus. We've gone through what you need to do these checks, how to do them, how to document changes, and what to do if you do find any changes. So once again, thank you so much for watching. I super appreciate you. That is it for this video. I will catch you in the next one.